Thymus gland. Thymus is located between lungs behind the sternum on the ventral side of aorta. It is a soft, pinkish, bilobed mass of the lymphoid tissue. Bilobed mass of lymphoid tissue located between the lungs behind the sternum. At birth, it is a prominent gland, but it gradually atrophies in the adult. Thymus plays a major role in the development of the immune system. It secretes the peptide hormones named thymosins, which stimulates the development and differentiation of T lymphocytes. Which provides cell-mediated immunity, thus increasing resistance to infection. It also hastens attainment of the sexual maturity. In sexual maturity, in addition, thymosins also promote production of the antibodies to provide humoral immunity. Humoral. Thymus is degenerated in the old individuals, resulting in a decreased production of thymosins. As a result, the immune responses of the old persons become weak. Hazel's corpuscles are spherical rolled over bodies present in the thymus. They are phagocytic in the function. Hazel's corpuscles, spherical or oval shaped bodies. Next is the adrenal glands. They are paired structures located on top of kidneys. They are also called glands of emergency. The gland is composed of two types of tissue. The centrally located tissue is called the adrenal medulla, and the outside this lies the adrenal cortex. Okay. Adrenal medulla, it develops from the neuroectoderm of the embryo. Neuroectoderm of embryo. It secretes two hormones, norepinephrine and the epinephrine, which are commonly called the catecholamines. Which are norepinephrine and the epinephrine. Okay, norepinephrine and epinephrine are derived from the amino acid tyrosine. Adrenal medulla consists of chromaffin cells. These cells are modified postganglionic cells of the adrenal medulla and the adrenal cortex. They also consist of the chromaffin cells. These cells are modified postganglionic cells of the sympathetic nervous system and are connected with the preganglionic motor fibers of the sympathetic nervous system. Sympathetic nervous system and the adrenal medulla function as an integrated system called the sympathetico-adrenal system. Adrenal cortex is divided into three layers: zona glomerulata, zona fasciculata, It is the outer zone that lies just below the capsule. It secretes the hormones called the mineralocorticoids. It affects mineral homeostasis. Then the zona fasciculata. It is the middle and the widest. Cells arranged in long straight columns which secrete glucocorticoid. Because they regulate glucose homeostasis. Then we have zona reticularis, and which is the inner zone, consists of cells arranged in the branching cords which secrete gonadocorticoids or sex corticoids. Next we have the corticoids. Corticoids are the hormones of adrenal cortex. Commonly called the corticoids. Mineralocorticoids maintain water and electrolyte balance and blood volume in the body by regulating mineral metabolism. The major mineralocorticoid is aldosterone. Commonly called the salt retaining hormone. Salt retaining hormone. Low sodium level in the body stimulates release of aldosterone. It causes retention of the sodium and water from the kidney and increased urinary excretion of potassium and the phosphate ion. Thus, aldosterone helps in the maintenance of electrolytes, body fluid volume, osmotic pressure, and the blood pressure. Next is the glucocorticoids. If affect carbohydrate metabolism, however, they also affect metabolism of proteins and fats. They also stimulate gluconeogenesis, lipolysis, proteolysis, and inhibit cellular uptake and utilization of the amino acids. Glucocorticoids includes three main hormones: cortisol, corticosterone, and the cortisone. One of the three, cortisol, is the most abundant. Cortisol produces anti-inflammatory reaction and suppresses the immune responses. Cortisol is also involved in the maintaining the cardiovascular system as well as the kidney functions. Cortisol is used for treatment of allergy as it suppresses synthesis of the antibodies by inhibiting production of lymphocytes in the lymphoid tissue. It stimulates the RBC production under certain conditions of a body secretes cortisol. This is why it is also called as stress hormone. This is the catecholamines. The adrenal medulla secretes two hormones, adrenaline and the noradrenaline. Commonly called as catecholamines. Also stimulate the breakdown of the glycogen and resulting in an increased concentration of glucose in blood. In addition, they also stimulate the breakdown of the lipids and proteins. Norepinephrine or the noradrenaline. It regulates blood pressure under normal condition. It causes constriction of essentially all the blood vessels of the body. It causes increased activity of the heart. Inhibition of the gastrointestinal tract, dilation of the pupils of the eyes, etc. Epinephrine or the adrenaline. It is secreted at the time of emergency, hence called the emergency hormone. It causes are the same effects as those caused by the norepinephrine, but with minor differences. Epinephrine has a greater effect on the cardiac activity than norepinephrine. It causes only weak constriction of the blood vessels of the muscle in comparison. Weak constriction. Okay, with a much stronger constriction that results from norepinephrine. Disorders of the adrenal cortex, it is Addison's disease, Cushing's syndrome, Conn syndrome, adrenal virilism, gynecomastia. Addison's disease is caused due to deficiency of mineral and the glucocorticoids. Its symptoms include low blood sugar, low plasma sodium, high plasma potassium, increased urinary sodium, nausea, vomiting, diarrhea. Cushing syndrome is caused by excess of cortisol, high blood sugar, sugar in the urine, rise in plasma, fall in plasma. Then the Conn syndrome is due to excessive production of aldosterone. Adrenal virilism is appearance of male characters in the female is called the virilism. Excessive production of the male sexocorticoids produces male secondary sexual characters like beard, mustache, hoarse voice in women. Gynecomastia is the development of enlarged mammary glands in the males due to excessive secretion of estrogen in the males. Decreased testosterone may also lead to gynecomastia. Next, we have pancreas. It is a composite gland. Acts on both exocrine and the endocrine. The endocrine pancreas consists of the atlas of Langerhans. There are about 1 to 2 million islands of the in normal human pancreas represent only 1 to 2% of the pancreatic tissue. The two main types of the cells in the islets of the Langerhans are called the alpha and the beta cells. Alpha cells secrete a hormone called the glucagon, while the beta cells secrete insulin. The glucose homeostasis in blood is maintained jointly by the two hormones, insulin and the glucagon. Glucagon is a peptide hormone. It plays an important role in maintaining the normal blood glucose level. Glucagon acts mainly on the liver cells, hepatocytes, and stimulates acts on the liver cells and process stimulates the process called the gluconeogenesis, which also contributes to hyperglycemia. Glucagon reduces the cellular glucose uptake and utilization, thus, glucagon is a hyperglycemic hormone. Insulin is a peptide hormone which plays a major role in the regulation of glucose homeostasis. Glucose homeostasis. It acts mainly on the hepatocytes and adipocytes, cells of adipose tissue. And enhances cellular glucose uptake and utilization. As a result, there is a rapid movement of glucose from blood to hepatocytes and adipocytes, resulting in decreased glucose levels. Decreased glucose level is the hypoglycemia. Insulin also stimulates conversion of glucose to glycogen, which is the glycogenesis. Glucose to glycogen, it is called the glycogenesis. Insulin. Thyroid cells. Prolonged hyperglycemia leads to complex disorder called the diabetes mellitus. It is associated with the loss of glucose through urine and formation. Harmful, which are the ketone bodies. Diabetic patients are successfully treated with the insulin therapy. Next, we have the testes and the ovary. A pair of testes is present in the scrotal sac of the males. Testis performs dual function as a primary sex organ as well as the endocrine gland. Testis is composed of seminiferous tubules and stromal or the interstitial tissues. The Leydig cells, also known as interstitial cells, are present in the intertubular spaces and produce a group of hormone called the androgens, mainly testosterone. Androgens regulate the development maturation functions of the male accessory sex organs like the epididymis, vas deferens, seminal vesicles, prostate gland, urethra. These hormones stimulate muscular growth, growth of facial and the axial hair, aggressiveness, low pitch of voice, etc. Androgens play a major stimulatory role in the process of spermatogenesis. They act on the central neural system and influence the male sexual behavior. These hormones produce anabolic effects on the protein and carbohydrate metabolism. Then we have ovary. Female have a pair of ovaries located in the abdomen. Ovary is the primary female sex organ and the which produces one ovum during each menstrual cycle. In addition, ovary also produces two groups of steroid hormones called the estrogen and the progesterone. Ovary is composed of ovarian follicles and stromal tissue. Estrogen and progesterone are the steroid hormones. Ovary is composed of the ovarian follicles and stromal tissue. The estrogen is synthesized and secreted mainly by the growing ovarian follicles. After ovulation, the rupture follicle is converted to a structure called the corpus luteum, which secretes mainly progesterone. Estrogen produces wide-ranging actions such as stimulation of growth and activities of the female secondary sex organs, development of growing ovarian follicles, appearance of the female secondary sex characters, for example, high pitch of voice, etc., mammary gland development. Estrogens also regulate female sexual behavior. Progesterone supports pregnancy. It also acts on the mammary glands and stimulates the formation of the alveoli sac-like structures which store milk and milk secretion. We have the hormones of heart, kidney, and gastrointestinal tract (GIT). We have ANF, which is the atrial natriuretic factor, which decreases blood pressure by dilation of blood vessels. Decreases blood pressure. The juxtaglomerular cells of kidney secretes erythropoietin. Juxtaglomerular kidneys. It stimulates bone marrow to increase the production of RBC. Bone marrow to produce RBCs. Then we have the endocrine cells present in different parts of GIT secrete four major peptide hormones called the gastrin, secretin, cholecystokinin, and the gastric inhibitory peptide. Gastrin acts on the gastric glands and stimulates the secretion of the hydrochloric acid and the pepsinogen. Secretion acts on the exocrine pancreas and stimulates secretion of the water and the bicarbonate ions. Cholecystokinin acts on the both pancreas and the gallbladder and stimulates the secretion of the pancreatic enzymes and bile juice. GIP inhibits gastric secretion and the motility. Several other non-endocrine tissue secrete hormones called the growth factors. These factors are essential for the normal growth of tissues and their बंद करना